Australia's medicinal cannabis sector is at a crossroads. Patient numbers continue to rise, clinical needs are evolving, and regulation has not kept pace with real-world use. I'm Aaron Young, and this is Cannabiz in Conversation. Great to be with you as always. Today we're breaking down what's really happening in the market, the evidence base for medicinal cannabis and the risks, and we also are busting a few myths about this life-changing medicine. To do so, we're joined in the studio by Kristen Vickers, Chair of Medicinal Cannabis Industry Association, and Dr. Priya Iyer from Relief Australia, and also from London by Martin Lane, co-founder of Cannabiz, and from Israel by Dr. Orit Holzman from Lura Wellness. Welcome to you all. Martin, I'll start with you. If you could give us some context, I guess, to the current state of patient care. How many Australians are using medicinal cannabis each year?
Yeah, interestingly, there's no definitive answer to that question because the Therapeutic Goods Administration, the TGA, doesn't record the exact number of people who have been prescribed the medicine. What we do know is that the TGA issued around 1 million approvals to healthcare practitioners for medicinal cannabis in 2025. But that doesn't equate to 1 million patients because it includes things like repeat prescriptions and multiple scripts per patient. But based on those approvals, we also have survey results and some market data. It's likely to be at least 400,000 and potentially even double that. As to who they are, TGA figures suggest it's 60% men, 40% women, and most aged between 18 to 64.
Wow, there you go. That's a big number. Are we surprised by this, Martin?
Well, numbers have been growing year on year since medicinal cannabis was legalised in 2016. I do think that the current system of regulation probably is busting at the seams, so to speak, based on those numbers. It wasn't anticipated at the time that we would see that volume, but it has been consistently growing over that time.
Very interesting indeed. All right, I want to bring you in now if I can. What conditions are we treating here? And I guess which products are they using?
So there's no limitations to the conditions you can treat with medicinal cannabis in Australia, as long as there is some evidence to support the usage of it. The TGA will theoretically at least approve your application. The condition, according to the information from the TGA portal in terms of special access scheme applications, the most treated condition is chronic pain, but that is followed very closely, and the numbers have been going up for treatment of anxiety. Other conditions that are relatively commonly treated are insomnia, PTSD, but there are also others such as Parkinson's disease, epilepsy, and autism. It's difficult to know which conditions are treated under the authorized prescriber scheme because we don't have that data. We just have numbers of the categories of products that have been prescribed, but not the conditions for which they were prescribed for. In terms of what is used, that would vary from patient to patient, but in terms of numbers, then still oral liquids are the most highly prescribed, again, under the special access scheme. So that will be oils, tinctures, and so forth. Gummies have been getting a lot of popularity, or pastilles as they are professionally called, but also dry herb used by vaporization, and extracts, so distillates that are more concentrated, used via inhalation, has been climbing up in numbers as well.
Really fascinating stuff. I'll bring it back to the studio now if I can, and I'll start with you, Priya. What evidence do we have about patients getting benefits from medicinal cannabis? What do we know?
To be honest, I see the evidence every day in my consulting work. I work with so many patients day to day and getting them some great outcomes. Typically, the early sort of signs of progress and clinical benefit I see is, better sleep. They start down titrating some of their other medication use. They start becoming more functional at work and in their families, and that's like the real world anecdotal evidence that I'm getting. There's of course, randomized control trial evidence studies and systematic reviews, but it all starts with these, cases that we see day to day, and then build up the evidence from there.
It's fascinating to watch, isn't it?
Extremely rewarding as a job.
Yeah, very much so. And I'll get your thoughts on this as well, Kristen, about, I guess, what more we need to demonstrate the efficacy here and also safety. What are your thoughts?
Yeah, I mean, breaking those two categories up between efficacy and safety, I think when we look at it from an efficacy point of view, I mean, there's hundreds of thousands of Australians that are now using medical cannabis. So it's not a fringe therapy, so to speak. You know, it is a regulated medicine that's being used to treat hundreds of thousands of Australians. So I think in that the efficacy piece is really important. Obviously, there's some data that the TGA builds, but we need to really leverage that data to truly understand the insights that data is generating. To build an evidence base which then supports the efficacy. So I think there's a number of elements to that in terms of building a national evidence database and using some of the TGA data that's already being collected, but then going further than that. So it's about asking the right questions to the right clinical question and using the data over time to support the efficacy piece.
It's interesting you say about the data there, because as we're hearing from Martin, the data is part of the problem in terms of knowing how many people and who they're using, but you're saying use what we have to try and build it out more.
Well, absolutely, because it goes to Dr. Priya's point in terms of seeing what we see anecdotally in practice. So it's using that data to support, I guess, what we're seeing in real world. And when you look at the TGA, and Australia being one of the largest federally legalised, medicinal cannabis use countries in the world, we're at the leading edge of the data that we have. We just need to better utilise that data to glean the insights to support the evidence. And I think that's where a national evidence register would be really beneficial to supporting the efficacy ultimately of this therapy.
To speak to that from a doctor's perspective, exactly what you said, Kristen, that it's not something that is taught in medical schools, and something that I myself learned, within my GP training, subsequent in my fellowship. So, the late onset of the education is a problem. We need to really educate doctors, nurses, all of the healthcare professionals, even allied health, that we get a lot of referrals, from physios that are not able to help patients that are having their pain issues. We can supplement and really support them in their other sort of goals and other therapies. As
a doctor, you would see it, and I would imagine be somewhat frustrated by the amount of misconceptions out there around patient care here. Talk to me about that.
That's right. There definitely are a lot of misconceptions, not only with patients, but also doctors and fellow doctors. And I used to maybe even be one of those doctors, admittedly.
What changed for you?
The thing that changed for me, I'd say, is being a traditional doctor, prescribing Western medicines and getting suboptimal outcomes. Wanting to explore other sort of ways to be able to help my patients with holistic and even natural approaches that patients often came and asked me about. I myself may have turned them away back then, but thought that no, I should really broaden my own education, try to be able to prescribe what is being asked for, look into whether that's a viable option, discovering the wonders of the endocannabinoid system, really, and from there, the science backs what we're doing.
All right, I want to bring you back in if I can. Do you think the increased use of particularly high THC medicinal cannabis linked to, I guess, higher risk of psychosis is problematic when it comes to dependence?
Unfortunately, THC is not without risk. It can be a fantastic therapeutic molecule when it's used correctly. So I'm definitely not against the use of THC as part of a proper treatment protocol, not being used on its own, being used as a part of a formulation that contains other cannabinoids, mainly CBD as well, not just used via inhalation. But yes, absolutely, we have evidence to show that with increased percentage of THC and with younger age of use onset, there is an increased risk of cannabis use disorder and psychosis. We don't have strong evidence to support that THC directly causes psychosis, but there is an association. And again, even with with cannabis use disorder, but with drug dependency in general, the notion that cannabis may be a gateway drug, there isn't a strong support to that.
So Kristen, talk to us about tighter access to medicinal cannabis and the meaningful impact that I guess it could have on patients with genuine clinical care.
Yeah, like at the end of the day, legalization has come about through harm minimization. And I think using those harm minimization principles, the data is becoming more transparent. So it's not like there's been this rapid increase of use of cannabis. It's just become more transparent because it's under the judgment of clinical practitioners. And with that oversight, that helps build the body of evidence and the science to support its therapeutic utility in medicine. So that's kind of where, any regulatory reform, it can, if incorrectly applied, I guess create a bit of a knee-jerk reaction and ultimately harm those patients that are most at risk. And they lose, I guess, the protection that exists by going through a traditional healthcare system with clinical oversight to help them, harm minimize or to treat indications. So I think for most medical cannabis patients, it's actually more about, it's not a first-line therapy, it's actually the last resort. And when they get quality of life improvement and relief from the use of medical cannabis under a physician's care, there's much greater benefit. And we work in a regulatory environment where it's a risk-benefit framework. So when you look at the risk and the adverse events being 0.06 or roughly thereabouts, there's 99.4% of benefit when you look at it holistically. Mm-hmm. So the benefits certainly outweigh the risk, but we're very keen to work with the regulators to be a professional partner in applying appropriate regulation reform to improve access and ultimately those medical cannabis patients that are in need of the therapy.
And Martin, keen to get your final thoughts here as well, closing thoughts on today's conversation. What have you made of what has been said?
Yeah, thanks, Aaron. I think it's really important to say that the industry acknowledges that the current system of regulation needs reform. But as we've heard, hundreds of thousands of Australians are getting huge benefits from medicinal cannabis. So the industry set out a series of pragmatic reforms in response to the TGA review, which would kind of ensure patients still get the highest quality of care, but can access their medicine. We'll hear more about those next time.
Very much so. All right, that's where we're going to leave it for now. So Martin, Orit there in London and in Israel, and here in the studio, Kristen and Priya. Thank you all so much for joining us on today's program.
Thanks for having us.
And thank you for joining us as well. We'll have another episode of Cannabiz in Conversation next week. The program presented by Medicinal Cannabis Industry Australia and the Australian Medicinal Cannabis Association. I'm Aaron Young. You're watching Ticker. We'll be right back.